Hey everyone, so we're back this week with more exercises to help with functional activities and to make your life easier. So last week we did balance. This week is going to be squatting and getting lower to the floor due to knee pain. Um, so one of the major things, if someone comes in with knee pain that is with squatting, trying to go down stairs, down hills, all pretty much the same premise. So what we want to look at is how well they can control their motion is a big part of it. People can oftentimes do the up portion of a motion, go up a hill, go upstairs, stand up fairly well. It's going down that is the problem. So we really need to work on control and nice slow motion. The things we also have to think about is like what joints are involved. So of course you're having knee pain. So the quadriceps muscle is a really, really big one. The hamstring muscle on the back of the leg, and then a lot of stuff through your glutes and hips. On rare occasions, I do have to work more heavily with people with their calf muscles, but pretty much anything like neighboring a joint that's hurting is fair game to be going after to try to help you out. So I'm going to go through 4 exercises today that are pretty common for me to give out if I am just meeting someone for the first time and I'm sending them with a home program. So the first one is sitting in a chair. So sitting up nice and tall. You want a chair that will almost hit you right behind the knee. And what you're going to do is you're going to hold it up. You're going to hold it. So one of the things that people oftentimes come in to me is, oh yeah, I do these exercises and then they show me this. No, I want you to bring that leg up as high as you can get it to go with the back of your leg still touching the chair and hold it there for 5 seconds, 3 to 5. And then slowly lower it down. When we do this kind of stuff, there's no control happening. We need to make sure that we can control our motion. So you can do that even if you only have one painful knee. I would very highly recommend you do it on the opposite side. At the end of the video, I'm going to review like my tips and tricks for how many you're supposed to do. So just hang around for that. You're gonna hear that like over and over and over again. I want it to stick in your head. So that's number 1. Nice dining room chair is what you need for that. Next one that we're gonna do is going to be for up at the hip. So like I said, knee, also the hip is neighboring it. We need to pay attention a little bit to those ones too. So for that one, I'm gonna move our chair out of the way here. At home, you can use a counter, a railing, anything that you have that makes you feel stable. Also, if these are your first time doing them, like you can do them freestanding, but a lot of times people cheat. So it's nice to have something that helps you support your trunk a little bit. So what you're going to do is you can hang onto your counter, your railing, whatever it is. You're going to lean on one leg and put the weight over there. So typically, if this is the painful leg, this is kind of the one we are actually working on, but you'll notice a sneaky little feeling in that hip that is stabilizing over there. So you're gonna stand up nice and tall. You are going to bring your leg out to the side. And some people, it helps them to be like, they have to tap the ground kind of as far away from as they can without moving the rest of their body. So tapping that ground, holding for 2 to 3 seconds, and then bringing it back in nice and controlled. I'm going to turn to the side here, and from the side what you can see is that I'm not going straight out to the side. I'm actually going back at a little bit of an angle to touch that ground. Then from the back view, watching my trunk, I don't tip over to go out to the side. Everything stays nice and tall, and I go out to the side, I tap, and I come back in. So like I said about that sneaky other hip, yes, this is the one we were working just now, but oftentimes people will be like, I really feel it in that other hip. You're going to, because what is that hip doing? It is controlling your whole rest of your body, while this one is out doing its pointing and tapping. So now we've worked on some control from the knee and the hip. Now, another thing that helps people oftentimes, if they have pain going one direction, I will often have them go the other direction to help build on just overall strength. If you are not strong enough, or actually I should say, you don't have the capacity to do something, it's oftentimes going to become painful. So, the next one is you're going to find a step or something to step onto. This is a really high step for those of you that are just starting. It would be best probably if you are just starting and you have some really painful knees that you are looking at a 2, 3, 4 inch tops size step. And one of the biggest reasons for this is that I don't want you to cheat out of the motion that we're trying to do. So oftentimes these are cheats that I see when I tell people to do a step. They're like, oh yeah, I can do a step. And what they actually do is this back leg back here, they like pop off the ground. So that's not what we want. Another one is that when we do this, I'm going to want your knee all the way straight. What they will do is, if they're not actually strong enough, is they'll pull this leg up really fast and then they'll push with both together versus just the one. So we want to make sure that we have a step that you can manage and do the exercise well at and not just cheat around the capacity your body has at certain places. So what we're going to do, painful limb is going to be the one that is up on the step. You're going to take your body weight and you're going to shift it forward. You want nearly all of your weight at this point to be over this leg. So now you're going to squeeze from the back side of your leg and you're going to push up the step. And see this knee? You're going to get it all the way straight. I don't want you to slam it backwards. I want you to control it and get it all the way straight instead of cheating and helping to push with that other leg. So the leg you're working has to be all the way straight before you set the other one back on the box. If you are even at a small step and you are still having a hard time, you can use railings, countertop, whatever is next to you that is stable and secure to help. I would much rather you actually push through your arms a little bit to help you with the motion and have it be done correctly versus doing the cheats from the leg. The arms are a little bit more sensitive, and as time goes on and as you get stronger, it's a little bit easier to pull off that compensation and how much help you're giving through the arms versus trying to erase those bad habits. So I'll show you this from all sides here again. So from the front, you're going to shift that way forward, push up onto the step, knee all the way straight, and then set your leg down. Same thing from this side, foot here, lean forward. This one's just along for the ride, push up, and then step. Last one, lean forward, press up from the affected leg, up, and then place. One other thing with this is I do want you to try, when you are coming back down from this step, I want you to try to make it be the leg that you just used. So I just confused you because I just switched legs. So we were using our right. I'm going to demonstrate it on my right or left, and now I'm going to use my right. So if you push up with your right leg, I want you to try to come back down with your right leg as well. This is usually the more painful part of the motion, but if you have a stable surface next to you, again, you can use your arms as much as you need to make it comfortable, but still challenging for you to do. So that is our step up. The next one is an actual squat. So that is the problem we are trying to solve. We have to, at some point, get to the motion that is difficult for us. So squatting. Squatting is where you throw your butt back and then your hips and your knees then bend at pretty similarly to the same rate. So A lot of people will do this kind of as a squat. Nope, you can see my hips are going way more. Some people will do this as a squat. Nope, you can see my knees are going way more. They kind of both travel at the same time. Imagine you are just sitting back in a chair. That's what we want. So we've talked about how going down is oftentimes more painful. So what we need to pay attention to is, where does that discomfort start? I guarantee you have some sort of tolerable, comfortable range that you go through. So that's what I want you to find out. If you are doing a squat, trying to keep your heels on the ground, if you're trying to do a squat and you lower down, where does that discomfort start? Right there. Okay. So that's your first one. That's your test. So now on the next ones, you're going to go 1 inch above. So don't go as low as you did the first one. You know where the pain starts. Now go 1 inch above. So I'm going to go a little bit less. And now what you're going to do is you're going to hold it right here for 1, 2, 3, and then you're going to push back up. So that's one thing that people oftentimes do wrong within trying to make something better, is they push through the pain. We've all heard it, no pain, no gain. Absolute garbage. We want to throw that out the window. Our pain signals were put in our body for a reason. It's telling you it doesn't tolerate it well, it's not ready for it, you need to work up to it. So you want to get as close as you can and work right above it, so that those next areas start to go, oh, okay, we're going to strengthen up for this because so-and-so is trying to use this space that we don't really like. So there's nothing, does not mean your knees are bad. It does not mean your knees are broken. You would be surprised at how many people can squat, do amazing things, and have bad knees, as tagged on by the medical community. So that's what I want you to do, is I want you to really learn your body. You can still strengthen here. You have to start somewhere. Just like I gave the example of reading Latin last week when we were talking about balance, it applies to these strengthening exercises too. I can't get you to do this kind of squat if you can't do this kind of squat. So we need to work in the range you can. Know what you can, work here, and then we're going to build down to getting lower. So every time you do them, pay attention. Sometimes it's helpful to have a chair or something behind you, so you can be like, oh, today I touched the chair. I've never touched the chair. Make it really objective for yourself so you can figure out if you are actually getting better or not. So with those 4 exercises, you are going to hear this little speech over and over and over again if you watch my videos. How do you know how many to do? It is not 3 by 10 if you are hanging out with me. Again, just like pain, our body gives us warning signals prior to pain that we need to start thinking about what we're doing. So you're going to think, get your baseline, figure out what your baseline is for your soreness level and things like that. You are then going to do your exercise. When you start to notice a change from your baseline, so if you're starting and you have a soreness level of 3 out of 10 just on your normal baseline there, what you want to do is you're going to, if it's at number 5, you're like, ooh, like I'm starting to notice that this is getting a little more sore, or it's getting fatigued through the front of the leg. You are then going to do 3 more repetitions past that. So if you did 5, noticed something changing, tired or sore, those are both okay, you're going to do 3 extra repetitions past that. What we're trying to do is we're hitting the point where the body says, hey, whoa, we need to slow down, but we're going to push it slightly so that the body then knows we're going to be making changes to it. So that's the first rule, is that you need to make something a little bit tired and a little bit sore in order to get our brain to send signals to make positive changes in our body. Sharp and stabby is an absolute no-go. Every once in a while, if you are really in here, you know your body, and sometimes you'll get a fluky, sharp pain. You can do it once and be like, oh, that was a little sharp. Try it again. If it's still sharp, just give it a break for a little bit. Do your other exercises and come back to it and try it again. The other things are, again, it's okay to be sore. That's how our body makes changes. We add stress to it. It needs to respond to it. If you do your exercises and you are sore afterwards, a little bit more sore than when you started, perfectly fine. But it should be tapering off within an hour of getting done of your exercises. After that, we have the next morning rule. So sometimes pain can be delayed. So we have to actually manage that into it. A lot of people will be like, I was really good during the workout, and then the next morning I was dead flat out. That's not also what we want. You can be muscly sore, you can be a little bit stiff because those muscles worked and are trying to repair themselves, but you shouldn't hate your life. So the next morning, you have to assess as well. If you don't want to move, don't want to get out of bed, something was a little bit too much in the program before. So the next time you do it, doesn't mean don't do it. The next time you do it, assess what you really and truly felt during that last time you did the exercises. And then you can change the range of motion you went through, the load you were holding, or the repetitions that you did. So if you did 20 of them, because that's our top number, because I always tell people, go until 20, build up until you get to 20 repetitions. But you just went to 20 without that build up, that sore fatigue, and then building up slowly, and you just wanted to get to 20, and you wake up really sore the next morning, you can pare those back down. Really pay attention to where your sore starts and where your 3 might be. So that's one of the big things, is I really want you to really self-reflect when you are doing these things. If we pay attention to the signals our body gives us and really truly honor what they are saying, you're going to see amazing results no matter what. So we will end it there. Again, this is not where every person is going to be or be able to start from. There are things that I can give people that are less than what I did today. And that's important to know. I feel like in kind of any exercise realm, it's like, ooh, this is an easy version. Guess what? There are 20 easier versions I can give you. So don't feel like you failed if you cannot even do what seems like a really easy exercise because it's painful. We can make it easier. You're just not there yet, but you can get there. So if you have any comments, questions, concerns, please leave them below. If you have any other suggestions for functional activities that you struggle with, leave them below. And it is important, I want the activity. I don't want the region that has pain. I want the activity. That gives me much more information just than my shoulder hurts. Well, does your shoulder hurt going behind the back? Does it hurt reaching up? Does it hurt reaching across? Those are all completely different things. So give me the activity that is uncomfortable. All right, stay healthy and become resilient. I'll see you later, guys.